Hi there, it's Dr. Schuette. I just wanted to take this opportunity to kind of review a few postoperative instructions about your extraction you had earlier today. First and foremost, you are probably still numb, which is a good thing. If you are not still numb, I hope that you have taken the opportunity to get your pain medication on board before the numbing has worn off. The most important thing between now and the next few days is maintaining a good schedule of pain control. And so that usually means staying ahead of the curve. First and foremost, like we talked about just a second ago, staying on top of it before the anesthetic wears off. So I strongly encourage the use of over-the-counter pain medications for most extractions. You can traditionally alternate between ibuprofen and Tylenol. Now, obviously, this has to be modified if there's any sort of allergy or reason why some patients can or cannot take certain medications. But for the most part, alternating between Tylenol and ibuprofen is the most effective way to take care of any dental and surgical pain when it comes to the dental field. So taking that before your dental anesthesia wears off and then on the regular schedule for the next 2 to 3 days is super, super important. We should have given you a post-operative pain sheet. Make sure you follow that and make sure you give us a call if you do have any questions about that. Over the next 24 hours, you may notice a little bit of bleeding and oozing from your extraction site. So it's super important if you do notice that bleeding starts to increase that you apply some pressure to your extraction site. Fold the gauze that was given to you up into, fold it in half and then in half again. I usually recommend dampening it a little bit and then nice firm pressure on there. If that bleeding turns a little bit more aggressive or a little heavier bleeding by this evening, what I would like you to do is actually bite on a tea bag. It may not taste the best, but the tannic acid in the tea bag is going to help to form a clot that should be pretty effective for you. One other thing I usually recommend for the first night tonight is to go ahead and place an old towel over your pillowcase, because if you sleep the way that I do, you may drool a little bit during the night. And a little bit of drooling along with saliva and blood, you don't want to ruin a nice pillowcase of yours. Take it easy tonight and tomorrow. It might be a good excuse to maybe have some people spoil you, and no heavy lifting or working out today and tonight. Also avoid eating hard, crunchy foods or hot and spicy foods, both temperature and spice. We don't want to restart any bleeding once the clotting has taken place. The other super important thing that we want to make sure that we're doing is avoiding drinking through a straw and no smoking. We don't want to dislodge that bleeding clot that we work so hard to form. So if you happen to notice that at day 2, particularly day 3 and 4, you start to increase in pain, that's something that we do need to know about. But I would anticipate for most extractions, pain is going to be present for about from day 1 to day 5. Think about if you're going to the gym and working out. You get inflammation, it peaks about day 2 to 3. That's the same thing with an extraction. We're creating inflammation in that healing site. So you are going to get pain day 2 and day 3. That's very, very normal. It should start to decrease day 4, day 5, but you should still have a little bit of underlying pain for almost a week. The gums around the area may continue to be open and not completely close in for a full week or so. And the bone around there is going to take up to almost 6 whole months to heal. So this is a long process. You had a surgery today and it's going to take some time to heal. But don't forget, we're here for you. So if you have any questions, if you need anything, give us a call. Most importantly, around day 5, if you start to develop pain that the Tylenol and ibuprofen isn't helping with, if things were starting to get better and then all of a sudden they start to get bad again, give us a call. We needed to know about that. The other thing we would need to know about is if you start to develop any fever, any swelling that's warm, or any obviously any bleeding that kind of starts up again, or any reactions to any medications. Those are signs. Give us a call. I hope you're doing all right. Hang in there. And if you need anything, we're here for you. Take care.